Today I'd like to talk a little bit about how the stabilizing muscles around our spine work and what sort of problems look like. I made a little model. We can all laugh for a second about my model. I made this with a pool toy and some chopsticks and rubber bands. But at least with this we can illustrate some of the basic functions of how our joints are being stabilized. So we have layers of muscles around the joints. The deepest layers of muscles are meant really just to hold the joints together so that when we have forces acting on our body, it can create stability within the joint. They also guide the joint to move in a certain way so that it's moving through the appropriate ranges of motion. We have other muscles stacked out further away from the joint, which attach to other points, which are designed to actually move the joint. So some muscles stabilize and coordinate the deep motion of the joint, and others allow the whole joint complex or series of bones or joints to move together as a whole. So what I'm going to be talking about here is just the deep muscles. Okay, so these are just the deep muscles, the deep stabilizing muscles. Now this is a post-traumatic joint in this example. So in other words, what's happened, if you watched my previous videos about joint trauma, you'll know that what ends up happening is when we have a high velocity, high amplitude motion that happens in a joint, like in a whiplash, say you're in a car and your car gets hit from the side, your head would get bent to the side very quickly, and that very, very fast stretch is going to change the length of these stabilizing muscles. The way that that happens is when that very, very high speed of stretch is sensed by different sensors in these muscles that are stabilizing. So all the muscles have two main types of sensors. One is a stretch sensor, which is a muscle spindle, and that's in the main part of the muscle. And that senses what we call the rate of change, or the speed with which the muscle is getting longer. Okay, that's what the muscle spindle does. But it has a maximum threshold. In other words, there's a maximum rate of change that it can sense. After a certain rate of change, in other words, if the joint is bending so fast, so quickly, these sensors can't actually pick that up. They can't sense it. So what ends up happening is it just turns into a load. So the load sensor, which is Golgi tendon organ, senses this. Okay, so in other words, what you're doing is when you have a very, very high speed stretch, the rate of change is so great that the muscle spindle has less output, whereas there's more load because your body can't sense the rate of change and respond to it because it's beyond that threshold, and the sensation is sensed mainly by the Golgi tendon, or there's a bias towards the Golgi tendon. So when you have a very high velocity stretch, the speed of the stretch will be sensed mainly by the Golgi tendon organ, which is in the muscular tendinous junction, so where the muscle finishes and turns into a tendon before it goes into the bone. There's a Golgi tendon organ on both ends of the muscle. So those sensors get activated, and in that moment it actually creates what we call a resetting of the gain of the muscle, and actually resets that muscle to a new length. So even if we were to try to straighten that joint out, we'll see that the muscles will be quite saggy because they were lengthened. Okay? One of the things that we use as tools in manual therapies, I can speak mainly in my profession as a chiropractor, is that we can use that same effect of lengthening a muscle through a very, very high velocity stretch to lengthen the muscles on the other side. So when we adjust a joint, what we're doing is we're creating a very, very fast stretch of these muscles to do the same thing that happened in the accident, really, which is to make that muscle lengthen. Now the big difference is when you have a car accident, that's what we call high velocity, high amplitude. So in other words, it's very, very fast, but it also moves very far, okay? And the joint will move far beyond its normal range of motion, and then that can actually damage some of the other tissue around the joint. So that's how you actually injure a joint. So we're talking about the consequence of the muscles, which is the lengthening effect of these muscles due to the shifting of the load towards the Golgi tendon organ, but then also in a high velocity, high amplitude type of trauma, you could damage other ligamentous structures around the joints. chiropractors use what we call high velocity, low amplitude stretch, which is we stretch a muscle very, very fast, but through a very, very short motion. So the idea is that if we're moving it through a short motion, we're not going to be having any negative effect on the joint, because we're not moving the joint in a way that is going to compromise the joint. So essentially what we're doing is doing a very similar thing, a high velocity stretch on these muscles to try to get these muscles to relax, so that when they relax they lengthen, and then they're going to partly approximate the length of the other muscles on the other side. Now, that's generally how a chiropractic adjustment is meant to work. One of the things that I'm proposing as well is that what I think we should be doing is focusing on figuring out where a joint is not moving towards its neutral position. So rather than taking a joint that's stuck like this and bending it all the way over this way, moving it to the end range of motion and then thrusting, what I would suggest is that we find a way to stretch this muscle and finish it at a neutral position, and that, I feel, is going to have a greater probability of maintaining a long-term integrity of these muscles that are stabilizing the joints. So if you're acute enough, you would probably realize that even if we stretch these muscles and make them the same length as this, they're probably still too long. And yes, that's true. However, there are many other mechanisms, and I'll go into that in future videos, of how this type of stretch and this new activation of the joint, and the fact that as it's moving through neutral, is going to stimulate other higher centers, particularly in the brainstem, so not just at the joint level, but in the brainstem and the control system that activates these stabilizing muscles. So in effect, what that means is, without explaining the whole thing, is that if we can get this muscle to relax, such that the joint can move through neutral, we're going to create a stimulation of or a type of motion or a capability of motion of the joint, which will activate centers in the brainstem, which will then activate these muscles to create a balance of tone, so that we have the appropriate amount of tension of the muscles which are stabilizing the joint. So just in review, what's happening here is that we start with a trauma joint where the muscles aren't stabilizing properly. We can apply a force, which is a high velocity, low amplitude force, to lengthen these muscles on the other side of the joint, to bring it back towards a neutral position. And what I would argue is that if we can finish our adjustment at a neutral position, then we have a greater probability of activating the higher centers in the brainstem, to then increase the activation of the stabilizing muscles, and thus create long-term integrity of the joint. So I'll talk about this more in more detail, but I just wanted to play a little bit with this model I just made and give you a little bit of an insight into how those joint stabilizers are working. Thanks for watching.